Silent Power, we're continuing our discussion of plastic surgery. One of the greatest risks involved in plastic surgery is scarring. And joining us, of course, is Dr. Bruce Katz. Scar prevention and treatment is one of your areas of expertise. How much of your work goes to scar revisions?
Well, I think a small part of our practice is related to scar revision, and we subspecialize in that area. Fortunately, it's not a huge problem, but we do see cases where some people end up with scars as a result of cosmetic surgery, either because of the way they heal, and I think in rarer instances because of the technique of the surgeon.
There are genetic considerations too. I know African Americans have a tendency to keloiding. Why don't you explain what keloiding?
Well, keloids are really scars that become raised over the surrounding tissue after surgery or injury. And as you say, that's very common amongst African Americans, but also we see that in Asian Americans too. It can happen to anyone, in fact, but when it does happen, the key is to treat it early so that the scar doesn't settle in and stay there, and that's very important.
I'm thinking of something like a port wine stain too. There's amazing progress in getting rid of those as well, yes?
That's true, and with port wine stains, we're using lasers that can take them away. And in fact, there's a new laser now taking care of port wine stains where you don't get black and blue, which was the problem with previous lasers. But port wine stains are really more a proliferation of blood vessels. It's not really, in fact, scar tissue. But scars now can be improved by the use of lasers. There's a new type of laser that we use to take away the redness. And then we use a second type of laser at the same time to flatten out the scar itself. So two different lasers are used to treat one scar with really dramatic results.
Amazing technology, changing every day. In fact, we wanted to take a moment to show you a piece of tape. We spoke with some of Dr. Katz's patients, and we learned that sometimes people who undergo any form of surgery are just more prone to scarring, as the doctor was just saying. The people you're about to meet were kind enough to share their stories of what happened after their surgery.
The pain is there. It's always there.
It's been difficult to deal with the scars because, you know, a lot of your self-esteem comes from your physical appearance.
These are two women who had unexpected side effects from plastic surgery, painful scars.
Our patients are very emotionally upset and concerned because here they are going for a cosmetic procedure and they end up looking worse in some cases than they did before.
Dr. Bruce Katz is Director of Dermatologic Cosmetic Surgery at Columbia Presbyterian Hospital. He's a recognized pioneer in treating scars with lasers.
And I see a lot of patients who have had ugly scarring after a cosmetic procedure. With no fault of the surgeon, it can just occur because that person heals that way.
26-year-old Mary, who asked not to be identified, had breast reduction surgery 1 year ago. She's now seeing Dr. Katz to help reduce scars from that operation.
The thing is, when you go to see a doctor and they tell you about the procedure, they usually show you pictures of these perfect results. It took me about a year to realize that they weren't healing as I had wanted them to heal.
Mary's keloid scars were similar to these. It's been 2 weeks now since Dr. Katz started his scar revision. Costs about $400 per laser treatment. How's it feel? Well, some say it's like a rubber band hitting the skin.
You can see we'll just touch it there.
Well, they're a bit red, but they seem to be fading. It's only been about 2 weeks now, so we'll have to see what the results are in a couple of months.
Using a laser, Dr. Katz says keloid scars can go from this to this, about 60% erased, but less red and a lot more comfortable.
Let's take a look. Let's see how these ears are doing.
Linda has some hard, knobby keloid scars behind her ears, remnants of an old facelift from years ago.
Unbelievable. We have to be very careful because it's always tender and it's embarrassing, and this is one of the risks involved in being cut.
There are some scars that we use combination treatments for. We can use laser surgery, we can use certain types of sheeting that will improve the scars too, injections of medicine. And the combinations are often very helpful. The ideal time to treat these scars is about 8 weeks after the surgery. I think a lot of women who have this type of scarring after a cosmetic procedure are very unsettled by it, very self-conscious about it too.
Had I known that the scars would have been so significant, I don't know if I would have chosen to have the surgery done. It's hard to say.
What can previous scars tell patients about how they'll heal?
Well, that's a very important issue. We look at people's scars in other areas of their body and see how they've healed before. That tells us how their body will heal. We look at the way they pigment. Some women, when they cook, or men, when they're working in the garage, get scrapes on their arms and they get pigmentation. That often is a sign that they will heal poorly and develop hyperpigmentation or too much pigment. So we look at these areas to see how any type of surgery will affect them, and telltale signs are often on the body from previous injuries.
Interesting, yeah. Importantly, how much will insurance pay in scar revision?
That varies. It depends if they consider it reconstructive work, which in that case the insurance company will cover it. If they think it's purely cosmetic, then they often will not.
Okay. It's a growing, as we've talked about before, it's a growing field. Many more people are taking advantage of it because costs have come down somewhat in the last couple of years. We were just looking at some costs a couple days ago on the morning show about breast enlargements are down about $400 or $500, and other surgeries now with the use of lasers are much more affordable. Do people have to be extra careful because of that, because it's more appealing now?
Well, I think there are certainly more physicians who are doing these procedures, and I think it's important as well that one check their physician out carefully, be sure that they are certified in the area that they're interested in have surgery performed. And then you can tell if you're working with someone who has a good deal of experience, knows their procedures well, and if someone's not just starting out with a new type of laser and have no idea what they're doing. That can be
terribly careful. And to that point, we've got some names we're going to put up. I just want to make a quick point about medications with scarring. You have to be careful if you're taking Accutane.
Well, yes, we've found, and we've published on this, that Accutane can increase one's risk of scarring after surgery if one takes the Accutane before the cosmetic surgery, and even if you've taken the Accutane after the cosmetic surgery. So that's one area. There's some other medicines too, but Accutane is the important
one. It's normally
one.
an anti-acne medication, is it not?
Exactly.
Yeah,
For treating acne. And you have to be careful before considering cosmetic surgery.
An informed consumer then. Let's give you those names now, names of board-certified doctors in the area. You can call for plastic surgery information. The number is an 800 number, 635-0635. Again, that's 800-635-0635. Please make that call and make sure that you've got a board-certified doctor at the very least. Then you interview them, you make sure that they understand your specific case.
Exactly.
Okay.
That's
Dr.
very
Katz,
important.
thanks for being with us.
My pleasure.
Nice
Learned a
to see
lot.
you.
Thank you.
If you know